Okay, now welcome to this video introducing evidence-based medicine. Now, the class that you took in the fall, we talked really about the fundamentals of evidence-based medicine, and that was our biostatistics and epidemiology. And those are really the underlying principles we need to know in order to understand what evidence-based medicine is. And typically when we think of evidence-based medicine, we're thinking about tools that help us make decisions in the clinical arena using well-conducted research studies. But it's really more than that, actually. It involves a lot of different things. Yes, it involves evidence, but it also includes patient values and the clinical judgment of the physician. And together, where these intersect, that's really what evidence-based medicine is. So what will typically happen is you'll be caring for a patient, and during the course of that encounter, you'll come up with a question to which you don't know the answer. You need to go look it up. So then you'll usually go to the internet and pull up a bunch of, type in the question, you get a bunch of possible answers. How do you know if they're of good enough quality to use or not? And this is where evidence-based medicine comes into play. It helps you make this decision in a systematic way. And there are traditionally 5 steps to evidence-based medicine. You ask a question, you go and get the evidence, you acquire it, then you go evaluate that evidence, you apply it to your patient, then you audit the process and see did it work or not. So in your clerkships, you're gonna go over some of these other things in a little bit more detail, like how to ask a question, how to acquire the evidence, and how to apply it to a patient. Right now, we're going to focus on assessing the papers that we pull in order to answer our questions. So as we learned previously, there are a couple of different ways to organize the different kinds of papers that are out there. You can organize it based on the type of study it is, the study design. And so that's where this evidence pyramid comes into play. Right? So we know that ideas and opinions, those are of some value, but they're not as strong evidence as the ones that are above it. So the higher up we go, the stronger the evidence. So that's how you organize papers by study design. But there's another way, and that's to organize the papers based on the type of question that was asked. And there are traditionally 5 different types of questions that you could ask. Questions of harm, like, does this particular exposure or does this drug hurt a person? Diagnosis, how good is this test at diagnosing whether a patient has something? Treatment, does this particular drug help someone? Does it make them get better? Prognosis, if somebody has a particular condition, how likely are they to survive? And systematic reviews and meta-analyses, that asks, what does the body of literature say about a particular topic? And this is the organizing framework that Gordon Guyatt out of McMaster University and David Sackett used to create something called their User's Guide to the Medical Literature, which they published in JAMA around 1993 to 2000. And that's become kind of the de facto way that we look at papers now. So when you look at a paper under this framework, you're really going to ask 3 questions. The first is, are the results valid? Meaning, is this study that we're looking at of good enough quality that we could even trust it? If it's done poorly, you're not going to read any further because you don't trust what it says. The next question is, what are the results? And so what you want to look at after that is, did they find something significant? And how sure are they of this result that they found? Maybe they found something that really doesn't matter. And finally, the last question you're going to ask yourself is, how can I apply these results to your patient? Does your patient match the scenario of this study? And so, over the course of the next 5 small groups that we have together, we're going to try and look at what examples of these. We're going to start off with harm papers. A paper that will ask you, does having exposure to something cause you any harm?